Well, hello class, and welcome to Module 8. Caring for children is usually a very enjoyable experience, but there are some instances that are not enjoyable. And one of those is the topic for this module, and that is that of child maltreatment, or children who are abused or neglected. Child maltreatment includes physical abuse, sexual abuse, emotional abuse, and neglect. Statistics to family violence and or abuse is very difficult to determine. Every year we know that over 3 million referrals to child protection services are made, alleging child maltreatment. We know that risk factors for abuse in children include those that are cared for by single or young parents, those that are living in poverty, children that are born prematurely, children that have chronic illness or disabilities. Risk factors for parents who abuse include parents that are substance users, abusers, parents that are under extreme stress, and parents who have been abused themselves. When assessing for abuse and or neglect, remember to ask children if they are afraid of anyone they know, or if anyone has touched them in a way that makes them uncomfortable. Remember to ask parents if they're afraid that they may hurt their child whenever they get frustrated. When you suspect that a child may be abused, if a child has had an injury, you want to look for any inconsistencies, meaning that the injury doesn't fit the story. If a parent describes the child falling off of the bed when the child is 1 month old, that's not something developmentally that a 1-month-old could do, is to roll. So you're looking for inconsistencies. Bruises that are on the chest, head, neck, or abdomen are suspicious for abuse. Nurses are mandated reporters. This means that we must report any suspected cases of child abuse or neglect to Child Protective Services. A history of child abuse is associated with anxiety, depression, suicidal ideation, and substance abuse. So we know that children are at higher risk for these disorders if they have been a victim of abuse or neglect. Child maltreatment is a difficult topic to discuss. Unfortunately, I have cared for many children who have been abused and neglected. It definitely is the most difficult part about being a pediatric nurse. We do need to remember that we need to continue to fight for children. We need to work to prevent abuse and neglect by educating parents and caregivers and actively looking for any signs of abuse and or neglect so we can help stop the abuse or neglect and help care for the child. Thanks.